Welcome, guys, to the program today. Appreciate your time today. Let's start with you, Dustin. You've heard the governor's request, strongly urging our citizens to, when we start reopening here very soon, to do the masks thing. So what is your role at CSEP EMA with helping with that order?
Yeah, thank you, Kelly, for having us on. We are going to continue to provide the masks needed for the response and healthcare workers who are taking care of patients who may be or are COVID positive. We're going to continue to do that. That's going to being done through our resource requests, and those folks know how to obtain the masks that they need through that system. We are currently working with our staff and the health department are working together to identify ways that the public can obtain masks or find avenues to make their own. Some things we're looking at is there's a lot of groups out there that are wanting to help put together masks. Maybe it's getting the appropriate cloth that's needed to make those put together with the people who can do them. Also looking at, there's a lot of YouTube videos out there. The governor used one the other day saying how you can make your own mask just out of a handkerchief and things like that. So we're going to work to put that information together, and you can we'll have hopefully we can be back on this program when we get ready to deploy that later this week or first of the next. But we'll also be pushing that out on our social media outlets, both us and the health department.
Excellent. Kelly, and what do you have to add with what the health department is contributing?
Well, I'm always impressed at how resourceful and creative that people are and how creative they can be. So everyone is encouraged, as Dustin mentioned, as they are able, to make their own cloth face covering to use when they're going out on those essential errands as we work toward things opening up a little bit. So we've have suggested and led people to the cdc.gov website and the Kentucky COVID-19 website for videos and instructions for sewing a mask, or for the no-sew options, which would be for me. I'm not a seamstress. But as he mentioned, discussions are underway as how to best coordinate efforts of those creative people to possibly help those in our community who are challenged or a little bit more vulnerable. So we're working, efforts are underway to establish something there. So we'll see what comes of that, but we're looking forward to a good cooperation. And as Dustin said, wearing a cloth face covering does not take the place of physical distancing. Wearing a cloth mask is just one countermeasure that work together with all the countermeasures to keep us healthy. So physical distancing, still staying home if you possibly can, avoiding the crowds, hand washing is very important. And a couple of things I wanted to mention about how, the proper way to wear a cloth mask. I think we may have all been out in the public and we've seen people who have them below their nose, or they're dangling off of one ear, or they pull them down under their chin. So that's not advisable. So it's important to label the outside of your mask so you know the difference between the outside and the inside. You don't want to touch the inside of your mask to compromise it. And we're going to be putting together video instructions to help people know what to do. Wash your hands before you put on your face covering. Again, wear it above your nose, below your chin. Don't dangle it off one ear. When you return home, place your cloth mask, your cloth face covering in the laundry. You need to launder that every day. And something I had to catch myself on, I have a cloth face covering and I was keeping it in my purse, and that's not advisable to scrunch it up in a pocket or your purse. But I need to have a baggie or an area where it can stay clean and not be contaminated by anything else in my purse or my pocket.
All right, well,
and
good
then wash
work.
your hands after you take it off too.
All right. Well, guys, appreciate your time so much. We're out of time today, but we will definitely have
Sorry.
you back. Oh, no, not at all. We enjoy it and very good words and good advice because we do not want to see a relapse in the good work that we have all done to contribute to the good stats and the trends that we're seeing. So we got it. And we will see you guys here soon when you have some more information. Thanks again for being on with us today.
Thank you.
Thank you.